Welcome to Brain Bits Part 3. My name is Kate Marquis, and today we'll be talking about strokes. So why do we choose strokes for Brain Bits Part 3? It's really all about the relevance, the prevalence, really, and the mortality associated with it. Strokes affect more than 795,000 people in the United States annually. It happens to be the fifth leading cause of death. Stroke kills about 140,000 Americans each year. That's 1 out of every 20 deaths. And someone has a stroke every 40 seconds. And every 4 minutes, someone will die from a stroke. So it's really a big deal. It's something that we see frequently, the emergency departments, neuro floors and such. And it really has this far-reaching effects because not only are we looking at the effects that it has on the patient, and the challenges patients can face trying to recover from one, but as well as the impact upon the family and their caregivers. So as we're looking at strokes, we're looking at two specific types. Both of these are due to oxygen-rich blood being unable to reach part of the brain for whatever reason. The first type of stroke is an ischemic stroke. This is when a clot restricts the blood supply to the tissues. Now, this may be due to a cerebral thrombosis, or it may be due to an embolism that's formed elsewhere in the body and has traveled to the brain. Embolisms are often caused by AFib. The ischemic type of stroke occurs 87% of stroke patients, so it's one of those things that you have to have a high index of suspicion for. The other type of stroke that we're going to look at are hemorrhagic strokes. These account for 13% of total strokes. They're a result of when a weakened vessel in the brain ruptures. Now, this may be due to an aneurysm, which is a weak point in a vessel which has ballooned out due to pressure, oftentimes hypertension, and then it eventually ruptures. Another way hemorrhagic stroke can occur may be due to an arteriovenous malformation, which is also called an AVM. And you can actually see a picture of this on the bottom right hand of your screen. This is a congenital condition in which veins and arteries are tangled and they bypass the capillary system. So you can see that on the right side, the AVM, it's kind of this tangled mess, veins and arteries, and they just totally skipped the capillaries there. Hemorrhagic strokes may be intracerebral or located in the subarachnoid space. When we think of strokes, we typically think about some common signs and symptoms. These include facial droop, arm numbness or weakness, and speech slurring. And these are all part of the Cincinnati Stroke Scale, and they're a part of that for a reason. These are very common signs and symptoms. However, depending on where the stroke is located in the brain, different symptoms may be present. In a left hemispheric stroke, you're going to see right hemiparesis, hemisensory loss, visual field deficits, and aphasia, because this is where Broca and Wernicke's areas are located. So this aphasia may be expressive, receptive, or global. In a right hemispheric stroke, you're going to see left hemi inattention, which is what we often call neglect, hemiparesis, and hemisensory loss. This patient will also be dysarthric, but not aphasic. Brainstem strokes kind of have some weird signs and symptoms. This patient may present with vertigo, imbalance, and tinnitus, which aren't necessarily typical signs of strokes. Other symptoms that may occur concurrently are dysarthria, dysphagia, decreased level of consciousness, diplopia, gaze deviation, nausea, vomiting, hiccups, and abnormal respirations. These can be particularly devastating strokes, as the brainstem is where all of the primal reflexes are. Your breathing, your heart beating, all of that stuff. Cerebellar strokes impair cerebellum, so you have impairment of balance and coordination. These patients may walk with a wide gait, may be off balance, and uncoordinated. Again, these are not typical signs and symptoms of a stroke. So get a good history and do your homework to ensure that you cover all your bases. The last thing I want to talk to you guys about today is about TIAs, or transient ischemic attacks. TIAs are a result of ischemia without infarction. Basically, the brain's hyperperfused for a short period of time, but the body's able to resolve that hypoperfusion. As these are often caused by clots, the body either dissolves the clot or it gets pushed further downstream into a bigger vessel, hopefully, so that the blood flow is then restored. This is an early warning sign of a stroke. In fact, 15% of people will have a stroke 3 months following a TIA, and up to 25% will die within a year. So this really should behoove the patient to go in and get some things resolved and see a neurologist, because they can truly lead to a bigger stroke and be deadly. In closing, strokes can be devastating, causing significant number of deaths within the United States and really worldwide annually. And time is brain. So to notice these abnormalities that are occurring as soon as they start occurring, or as soon as possible, will really help the morbidity and mortality of the patient population. So get help quickly. Thank you for tuning in to Brain Bits. I look forward to our next clip soon.